Hello, my name's Kate Peltyszyn, and I'm a physical therapist over at Valley Outpatient Rehab. I have a couple questions from the community that I'm here to answer. The first question is, what is physical therapy? So physical therapy is a field of healthcare in which we treat patients that are dealing with pain or mobility limitations. We do an evaluation and assess their needs and develop a treatment plan to get them to their goal or to help them reduce their pain. What schooling or credentials must a physical therapist have in order to practice? So the field of physical therapy has evolved over the years, and as such, so has the education requirements. Current graduates will leave school with a doctorate of physical therapy. This is typically obtained after completion of a 2.5 to 3 year program after undergraduate. These programs involve a lot, including introduction into research and sometimes requiring the student to complete a research project on their own, making sure they're up to date with the most recent evidence-based practice in the field. They also involve clinical affiliations in which the students have to go to a variety of settings so that they're better equipped when they become licensed and go out on their own once they graduate. To maintain your license, you're required to complete 30 hours of continuing education every 2 years. And this is done typically through completion of courses or certification programs. Some physical therapists elect to undergo or to pursue a board certification in a special area of physical therapy, including orthopedics, neurology, geriatrics, pediatrics. There's a bunch of them out there. And typically this is done either through completion of a residency program, which is after completion of the graduate program, or through independent study. What disorders do physical therapists treat, and what type of interventions are provided? So physical therapists see a wide variety of disorders. They could see orthopedic disorders or diagnoses including after surgery, after knee replacement, hip replacement, ACL reconstruction, or diagnoses that didn't require surgery, such as an ankle sprain or low back pain, neck pain. We also treat neurological disorders or diagnoses, especially after stroke or brain injury, or other neuromuscular disorders such as multiple sclerosis, Guillain-Barré syndrome, or peripheral neuropathy. Certain diagnoses have specific programs. Here at Valley, we have the LSVT BIG program, which is a specific program for patients with Parkinson's disease. That's been up and running and gaining momentum, and it's something we're really excited about. We also treat patients with vestibular disorders, patients with pelvic floor dysfunction, and patients with chronic pain, or maybe patients that can't fully tolerate the land therapy. We do offer aquatic therapy here at Valley. Here at Valley, we also have what's called the Gravity program, which is basically when we assess a patient's risk for falls, and based on our evaluation, we determine if they're appropriate for treatment and training to improve their walking ability and their balance to improve their safety in the home or in the community. Why should someone choose Valley Hospital Outpatient Rehab for my therapy needs? So Valley Hospital Outpatient Rehab uses a multidisciplinary approach, including speech-language pathology and occupational therapy, to ensure that the patient's needs are being met, sometimes simultaneously through both disciplines. We have a close communication and collaboration with the Valley Hospital and the physicians on staff, as well as access to medical records and diagnostic imaging results to ensure that we have a comprehensive view of what's going on with the patient to ensure they're getting the best care. We utilize a 1 to 2 patient ratio per hour, so we never see more than 2 patients. But the industry standard for physical therapy is really 3 to 4. So we have that more individualized attention for the patients. At Valley Outpatient Rehab, we do have a lot of therapists that have been here for a while, and we work really well together and collaborate to make sure our patients are getting the best care. Even if it's a patient that might not be my particular patient, we all tend to get to know each other and help each other out and really foster a good community for healing. If you guys have any questions, please feel free to reach out or stop by for a tour. Thank you.